Focus, we are committed to keeping you up to date on the outbreak of the Zika virus. And today the CDC issued new guidelines advising men who have traveled or live in an active Zika area to use protection during sex with a pregnant partner. And pregnant women returning from areas without the Zika virus are now encouraged to get tested between 2 and 12 weeks after they return. There are now 50 cases of the Zika virus nationwide. It has been found in 13 states and now also in the nation's capital. And joining us more to talk now about the disease is Dr. Trish Perl, a senior epidemiologist with Johns Hopkins. Dr. Perl, thanks so much for coming in.
Thank you.
A lot of folks are scared about this.
Well, there are a lot of unknowns.
So what do we need to know about it at this point?
We need to understand the basic epidemiology. How does this virus spread? How long is it in certain areas? How is it spread? Just all of the things. What kind of diseases does it cause? What's the spectrum of illness? So there are just a lot of unknowns. How to diagnose it.
Mm-hmm. And you're saying that that was an issue as well in terms of how to diagnose this.
Absolutely. It's a virus that looks like other viruses, and so when you do the laboratory testing, it can be confusing. And this is a time where you actually need very precise information because you're counseling people about very important decisions.
And just like we're learning about the virus, we're learning that the guidelines are evolving as well.
The guidelines are changing, and what we say today may absolutely change tomorrow just because the information is emerging very quickly.
What about a pregnant woman? I mean, you've seen some of the babies from the birth defects. It's frightening.
So the current association is very, very concerning, which is why the guidelines are actually pretty strict in terms of what they recommend. I don't think that at this point anyone wants to take any chances. It's important for people to understand that we still have to really prove causality. We have this association, but there's more scientific investigation that really needs to be done.
Now, we heard reports this week that it's been transmitted through sexual activity?
Well, what we've heard and what we've learned is that we can find it in semen and we can find it in saliva. So, you know, at this point we don't know which of these specimens is transmitting, but we clearly know that human contact is going to be important in a possible way of transmission, just like the worry is of the intrauterine transmission, potentially by blood transfusions, and then, of course, from mosquito to human.
So now we've heard about the case in the nation's capital. Do people here need to worry about it coming here?
The cases, as far as I'm aware of, have all been what we consider imported. So they've been people who have traveled to those areas, or potentially one sexual partner of somebody. So at this point, there is no indication that the virus is circulating in the United States. But again, I think we have to watch this. We have to have very good surveillance mechanisms in animals as well as humans to track it.
Okay, all right. I think we're going to be having you back because I think this is not going away anytime soon.
It's job security.
Dr. Perl, thanks so much for coming in. Let's send it over to Wyatt now for a look at the weather.